Hello, my name is Dr. Fred Sylvester from New Hanover Chiropractic, and welcome to this episode of Health Talk. COVID has always been in the forefront, probably for the last 18 months, and it doesn't look like it's going away anytime soon. We have an expert here, Dr. Singh, who is owner-operator of MedSurg in Gilbertsville. He's going to give us some of his stories and his concerns and his optimism as we start to move through this later phases of the pandemic. So, Dr. Singh, welcome. Thank you very much for coming.
Thank you for having me.
Absolutely. So what are the current trends? What are you seeing right now? You know, you're front line here, you're seeing everything, you're testing. What are you noticing? What's going on?
So we are seeing uptick in the cases again. We are seeing uptick in cases with a different variant. Previously, most of the cases were UK variant or Alpha variant. Now most of the cases are Delta variant. But we are definitely seeing more positive activity. More kids are testing positive as well.
Have you seen, you know, like when we all look at the graphs of, you know, we'll say the Pennsylvania health, you know, and dashboards and that type of stuff, you see things coming down in June, and you see now things kind of plateauing, now you start to see an uptick in that type of stuff. Are you seeing that in your own clinic as well?
Yes, we are seeing about 10% patients testing positive. So let's say if we are testing 20 patients, 2 of them will test positive.
So 2 of them are testing positive.
Yeah.
And again, that's up from where we were back in, we'll say, May or June?
Absolutely. We would have week or maybe 10 days without anybody testing positive.
Yeah.
So it's definitely there is activity on daily basis. There are patients testing positive.
So in the increase in positivity rate, and this is always a concern for, you know, everybody that's, you know, out there in the general public, are we seeing an uptick in hospitalizations? Are we seeing an uptick in death rates and those types of things, as well as far as you know?
Yes, I'm not most up to date on hospital data, but when you see uptick in number of cases, we know certain percentage of those cases going to end up needing hospitalization. Right. A certain proportion of those hospitalized patients going to need ICU help. Mm-hmm. And a small proportion of those unfortunate patients will die.
For sure.
So that's why the public health measures of social distancing, face mask, and the vaccination are still the best to prevent the spread of it. The lesser the number of cases we have, lesser hospitalization we're going to have, less morbidity, less mortality.
Gotcha. And I think the current trends right now, I think in Pennsylvania, we have 1 million confirmed cases over, you know, since the pandemic. I think we're about 30,000 people that have, you know, unfortunately have passed away from this disease at this point. One of the things that I don't know if you can shed some light on is that, you know, when I talk to patients as well, is one of the things that they are concerned about is that, okay, are those numbers actually accurate or not? And why did the flu disappear why did flu numbers disappear last year and kind of COVID numbers have increased? I have some of the observations, but what's your opinion on why flu numbers went down and everything else kind of went
So up? I think the science behind that is there was vast use of masks, which probably prevented flu, and people were more cautious. I think hand washing and just general heightened awareness, social distancing, meeting less people during winter time, staying within the family. I think all those factors made a difference.
Absolutely.
We knew from what happened in Australia that we're going to have a less aggressive season with flu because Australia did not see flu at all in 2020. So was Texas, and then when it came to our area, we did not have much flu activity. Yeah. Interestingly, we had a flu patient less than a month ago.
Wow.
Somebody tested positive for flu, but I think mask and frequent hand washing made a difference there.
And that's exactly what I've read and kind of come across, you know, and it's amazing that those small little things reduced something that was claiming 50,000 lives a year.
Right. Another factor I feel which is important is the virulence factor of the virus. So, which is called R0. R0 for flu virus is much lower than, for example, Delta variant. So Delta variant, you can The analogy I can give you is if I have a smoke coming out of my mouth, it is very likely that some of that smoke going to get to you if you're sitting next to me.
Sure.
But if I'm talking and fine droplets are coming, it is, if you are at a safe distance or you have a mask on, it is less likely to get to you.
For sure.
Or the chances are lower. So Delta is like a smoke coming. So that's why scientists or public health officials are saying you will either get this disease, get Delta variant, or you get vaccine. You're
Sure.
going to have it one or other
One
way.
or the other.
So R naught for Delta variant is about 8,
Okay.
which makes it very highly infectious virus.
And I think I have read, as I was preparing for this, I think measles, you can correct me if I'm wrong, the R naught value was around 9 or 10, I'm not sure
That's
exactly.
the most infectious, yeah.
But you think about that, you know, how infectious measles is at
Right.
this time, and then you now start to put a kind of a comparison to where the R naught value for this Delta variant is at this
Right.
point. It does become a lot more concerning
A lot more,
to
yes.
you know, all of us who are in healthcare and all of us who are in the community.
Right.
So coming into this, you know, that's leading right into it. Delta variant. I mean, we were talking about Lambda, we were talking about all these other different things that are coming out and how they're identifying these. When you look at the alpha strain of the original virus of COVID, now we're into the Delta, and there's, I think, 13 others. You were talking about R naught value. How does this kind of, what type of landscape does this lay out for our future, you know, as we're looking at from a community standpoint, a nation standpoint, a world standpoint? What are our concerns with this Delta variant? And is it normal to have variants? That's the other
Right,
question.
right. I mean, whenever you have rapid replication of the virus, it is expected to give you variants. And if you look at the history, the trends are when you can have a virus which have high infectivity, but it causes less aggressive disease.
Okay.
If you have that kind of virus, that will cause a lot of infections. At the same time, you are building immunity in the community, and you might end up with a herd immunity,
Okay.
and then you are over epidemic or pandemic. But if at the same time, when virus replicates at a rapid pace, you can have a strain which can be very aggressive and very lethal.
Okay.
So Lambda is that strain, but it's the CDC is keeping an eye on that for over 5 months, and it has not caused too much activity as far as we know. It was originated in Peru,
Okay.
and they are keeping an eye on that. Most of the infections now are being caused by Delta variant, and I think this is going to stay as a predominant strain for now.
Okay.
The good thing about our country is we do have vaccinations available, and there has been more than 50% of population which have been vaccinated.
Sure.
So now the thought is, if we can get the boosters in and get through this winter season, on top of that, unvaccinated people are going to have some immunity through infection. So in coming spring, I think things should be better for at least our country.
Can you explain breakthrough rate, you know, on the vaccinated people, what that means, and is that something that is normal for having, you know, a vaccination?
I do not know the exact number on breakthrough rate, but there has been breakthrough infections in vaccinated people. The rate has been slightly lower with Pfizer and Moderna than J&J, but there has been in both the cases, and that is, we have seen that with every other vaccine.
Which is an important point. That's I think that's an important point to know.
Right.
Every vaccine has a breakthrough
Has
rate.
limitations.
Yeah.
Yes. There could be host factors, factors related to patient, not necessarily the vaccine itself. If somebody is on immunosuppressive drugs or immunocompromised, or their immune system did not respond to a vaccine,
Sure.
They're not going to have antibodies. And if you don't have antibodies, active T cells, then you're not going to have the expected or desired benefit from that vaccine.
Do you have any information on length of time that people have antibodies within themselves, whether they are tested positive for COVID or whether they are, have the vaccine in them? Is there a time frame that seems to be a waning immunity for people?
Yes, that's a very good question, and that's what they have been looking at since we started the vaccination.
Okay.
Because dealing with coronavirus, humans have dealt with this virus. 25% of normal colds are caused by coronavirus class,
Okay.
but not by COVID. COVID is a new strain.
Sure.
So we now, if you catch a cold, you build immunity for about average of 3 to 6 months, and then your immunity to that virus goes down, and you have tendency to catch a cold again with the same virus. So from that knowledge, we knew that this immunity gonna decrease over time. I think the average time frame or average length they have given us is 8 months, and that's why they are recommending you should go for a booster after 8 months from your second dose.
Do you have any numbers on what antibody levels should be like in a body? So, because I know you're doing the testing and that type of stuff, and we're going to get into that. But if you look at antibodies circulating within your system, is there a certain level that they want those antibodies to be at or above?
That is answered in evolution. Actually, I was reading an article this morning. There is no specific threshold which you look at, and you can say that if you have antibodies more than this level, you are protected. But what we know for sure is more antibodies you have, better protection you have.
Gotcha.
We know that for sure. And then T cells also contribute to immunity. There were about 2% of cases who had antibodies below a certain level, and they did not catch any infection. And I think the reasoning behind that was they had T cell mediated immunity, which protected them.
For sure. So when you're looking at, from your own personal experience and, in serving our community at this point, in the services that you offer at your clinic at this time, you are knee-deep in all the testing. You see it every day. Give us some ideas of what the testing's about, what type of different tests there are, and what are you looking for?
So broad classification of the test is a rapid test and a PCR. So those are commonly used tests. So rapid test is basically it's an immunoassay. You collect a nose swab from a patient, you mix it with a reagent, and you put it on a cassette. Give it 15 minutes, put it in a reader, and it give you the results.
Right.
Most of the commonly used rapid tests, their sensitivity ranges anywhere between 82% to 94%. Their specificity again varies with the test, but the test we use is close to 100%. So what that means is, if you have a positive rapid test, you are sure that it's truly positive. But if it is negative, there is about 18% to 6%, 7% chance it can be false negative.
Oh, so it's the other way. Okay. Yep.
Yes.
I see what you're saying.
So the guidelines recommend if anybody tests negative, you should back it up with a PCR test.
Do you do that with, if they're having signs and symptoms, or if it's just a concern of exposure? Do you know what I'm saying?
If somebody, if it is a high-risk exposure or patient has symptoms, we always back it up with a PCR.
So what's the PCR then? Is that just a more specific sensitive test then?
PCR is more sensitive, yes. PCR basically, by the technology, it multiplies the copies of the virus RNA genetic material, because if there is very small amount of genetic material in the collected sample, that can be missed on the test, and rapid runs on that platform. But if you multiply that genetic material, which is present in the initial sample, machine has or analyzer has high tendency to pick that up.
I gotcha.
It's so sensitive that even patients who have clinically recovered, they can continue to test positive even after recovering from COVID for months. And
That's
that was
sensitive.
actually a problem when when initial guidance was to have 2 negative tests before you can return back to work.
Sure.
So that's why that guideline was taken away.
Gotcha. So when you're looking at the testing and that type of stuff, that's one service that you offer. Some exciting news that you were sharing with me prior to this is the monoclonal antibodies.
Yes.
I'm not very familiar with it, so I'm going to give you the stage.
So monoclonal antibodies are these are synthetic antibodies which you can infuse in a patient who is at moderate risk of getting sick from COVID-19. So
are they infected or not infected? Is preventative or no?
Well, patient who has tested positive and patient is at moderate risk within 10 days of testing positive, within 10 days of start of symptoms, that person is eligible for monoclonal antibodies. There is other criteria too. We don't want to go in more details, but if you feel you have any heart problems, lung problems, you are immunocompromised in any ways, or you're obese, diabetic, it's a good idea to go for monoclonal antibody treatments, and they are very safe. Second piece to that is they have just approved it for post-exposure prophylaxis. Okay. So if you have a high-risk family member, somebody tested positive in the family, and that family member has been around that person, that high-risk family member can take antibody treatment prophylactically so he does not get sick with COVID-19. And it has been effective.
Is that delivery through mouth, through
shot? It's IV. It's an infusion. It comes in about 10 ml vial, and that is mixed with about 100 ml of normal saline. We put an IV line in. We run it for about 20 to 30 minutes, and we observe patient for about 1 hour after infusion to see if there is any immediate side effects. These infusion treatments, they are tolerated pretty well and very well. They have less side effects than I tell my patients. They have less side effects than the vaccine. Gotcha. With vaccine, you're going to see something the next day. With this, no. Yeah,
So with this was something that you were also alluding to as we first started this thing. I think you said President Trump had this type of therapy as well. Is that correct?
Right. So he had treatment with Regeneron, and we are doing Regenco, which is a combination of 2 antibodies.
Is that done on site, or does that have to go to hospital? How does that all delivered?
We do it here, but many ERs do it. Some infusion centers associated with the hospitals, they do it. Okay. But we try to bring our patients as quickly as possible, because the sooner you do it, better it works. You should do it within 10 days of start of symptoms, but it works best if you do it within 5 days. So let's say if somebody tests positive and they call us today, we get them in within 24 hours. So
it's exciting news to have in our community and that type of stuff, to be able to have that type of service that is being delivered in such a a contentious time of where we are with this pandemic.
I'm glad to do it.
Very much. So when we looked at the whole kind of concept we were talking about, how do you prevent and what's our best measures and that type of stuff? Give me your prevention medicine.
I think come to the same basics which has been put in practice right from the start. I'm advocate of face mask. I think I think masking help, frequent hand washing, social distancing where appropriate. If you're in outdoor setting, you want to take your mask off, go for it, But when you're around people you do not know, when you're in congregate setting, you should wear a face mask. If you're in a grocery store, wear a face mask. It takes little effort, but it can prevent you from a bad disease. If you other strong way to prevent this, which we are blessed to have that in our country, is vaccine.
It's abundant here.
Yes, and anybody who has not taken a vaccine, I recommend they should take it if they are eligible. Good thing about Pfizer vaccine is it has full approval, not emergency use anymore. It has full approval from FDA since yesterday.
Moderna will be closely behind.
Moderna should be close, yeah. Yeah, and they are looking at including kids from age 5 to 12. That may take time. That may not happen this year, but they are looking at the safety data in 5 to 12 year age pediatric patient population. But but if we can vaccinate our eligible patient population 12 and up, I think we're going to be in very good shape.
Sure. I think it's really interesting as preparing for this episode and prior other ones, you know, I have gone back to look at 1918 and kind of studied that. And I think what most people don't realize is in 1918, when the Spanish flu hit, you know, very contagious, claimed a lot of lives, hit a different sect of our population, more of our younger population. But they were doing the same thing at that time. In 1918, they were going back to mass social distancing, hand washing, all that type of stuff. The only thing that they didn't have in 1918 was a vaccine.
Yep.
And so 50 million people died in that time frame from 1918 to, I think, 1925, 24.
Right.
And, you know, by today's standards, if we have 8 billion people on this earth, if that would be the same type of extrapolation, we'd need about 200 to 300 million people to pass away. Wow. In order for that to, you know, for our herd immunity to occur with this type of thing without the vaccine.
Right. I never did that calculation in my head, but that's a good.
So it's just amazing. And I think I was sharing with you before, when you look at Arkansas and their vaccination rates being low, I think in the 30% range at this point, 98% of their deaths right now are in unvaccinated
patients. Yes,
and
that's
so
correct.
That just even emboldens you a little bit more to look at that vaccine.
Right.
Is the vaccine perfect? Probably not, but it's safer than the virus, I believe.
Right. We need to stay ahead of the virus, and only way we can do is by not letting our guards down and vaccinating, believe in science. That has kept our country ahead of everybody else.
For sure.
And I think we can continue to stay ahead if we follow science.
So I know kind of a summing up, but in the closing of this show here, what's your take-home message for everybody?
I think we should continue to stay vigilant. We should not let our guards down. Mask up, especially when you are around people who you do not know. Vaccinate if you're eligible, and just frequent hand washing, social distancing where appropriate. Let's hold off on large parties for a few more months, and I think we're gonna be in good shape coming spring.
I think one of the things I'll just kind of interject as take-home message is that I believe most of the deaths right now that are going to occur from this point forward are preventable.
That's true.
There, you know, and that's a piece that I think we all need to take into consideration.
Right.
So, thank you so much for coming on. Really appreciate your time, your effort, your service to our community. It's exceptional.
Thank you for having me. It's fun to help the community.
Absolutely.
I feel I'm part of it.
Absolutely.
Yeah.
Good day and good health.